Thanks for the introduction. So there have been several studies out in the literature looking at vessel wall imaging in brain AVMs, but most of those studies look at brain AVMs that have either ruptured or have had some sort of clinical impact. They do surmise in those studies that vessel wall enhancement could identify a site of rupture or that it may be a marker of unstable lesions prone to rupture, but we propose that this wall enhancement is a more complex process. To do this, we looked at a series of clinically unruptured, untreated brain arterial venous malformations with vessel wall imaging. We imaged a total of 8 patients. All of the lesions actually showed some sort of hyperintensity at or near the vessel wall within the nidus. Half of those patients actually had greater than 50% of those vessels showing hyperintensity at or near the vessel wall within that area of nidus, with 2 out of those 8 having 75 to 100% enhancement near or at the vessel wall. We also looked at perivascular hyperintensity or perivascular enhancement in the nidus, and we found that 3 out of those 8 cases had that as well. So here's just an example case in a subject that has a right temporoparietal brain AVM that has multiple areas of enhancement at the vessel wall here, present. This is example case 2. This was in a left frontal brain AVM that showed enhancement both at the vessel wall or hyperintensity, and then also these areas of kind of perivascular outside the vessel wall hyperintensity too. This is a case that shows one with less hyperintensity, and so there was just this one small area around and near one specific vessel. So while contrast hyperintensity has been seen in ruptured and post-treatment AVMs, ours is the first series to look at multiple cases that had had no prior clinically apparent hemorrhage or treatment, and all of those actually had some sort of hyperintensity present. It's kind of uncertain what that hyperintensity is. It could be increased permeability of the vessel wall or actual enhancement of the vessel wall, but there's likely a component of flow as well, such as slow flow that can be seen with aneurysms. So it's important to do longitudinal studies with 4D flow information in addition to histopath to further suss that out. Thank you.